Well, we all know mental health is so important, but today we're actually going to be focusing on the importance for busy parents and how important that is to take care of yourself. So psychiatrist Dr. Dianne DeKeyser and patient Nate Robinson are here with more. So thank you. Great to see you again and nice to meet you.
Good to see you.
Yeah. So Nate, let's actually start with you this time. Tell us how it is to balance your career and parenting and then, you know, your mental health on top of it.
Exactly. Thanks, Jordan, for having me here, first of all. It was a challenge, definitely. The hardest part about it was I didn't realize that I was in a place that I needed help. I was a father. I liken myself as a very present and happy guy. Professionally, everything was working pretty smoothly. And then one day I looked up and I realized I didn't have focus. I couldn't stay on the menial tasks that I was doing.
Right.
Things felt like tasks when they should have just been life. Honestly, there was a big contrast between the Nathan the high functioning Nate that I was, and the Nate that I had become.
Right.
And at that point, that's when I realized that I needed to take my mental health seriously, and seek professional help. And that's how I was able to meet Dr. DeKeyser and Serenity Mental Health.
Yeah, at Serenity Mental Health, Doctor, what treatments do you offer?
We offer medication management when someone doesn't have a psychiatrist. We also offer transcranial magnetic stimulation, or TMS, and then psychedelic medicine in the form of ketamine.
Really? I hear that's that's becoming very popular now.
All of it is very trendy as far as the TMS and the ketamine as well.
Okay, well, yeah, tell me about TMS then. I haven't heard of that one.
Sure. So TMS is via a coil gently stimulates your brain cells transcranially. Now the real question is, why would you want to do that?
Yeah, how does that help?
Right, and you know, as Nate just mentioned, a lot of people come in and they are so stressed, overwhelmed, exhausted. They know that they're not living the way they normally live. And so what TMS can do is start to stimulate these pathways, these neural circuits that are responsible for feeling motivated again and hopeful, joy, calm. And then after a few weeks, people start to notice that, like you just said, it's not an effort to wake up in the morning and do the simple things we have to do. Our minds become ignited, almost excited about doing, you know, new projects and hopeful that we can see the successful outcomes of things. So it's really exciting, and lots of people are, you know, trying to do it, and we love it.
I think it's fascinating that there are even science and technology that allows for something like this. I mean, it's amazing. So Nate, tell us a little bit about your experience with the TMS.
Definitely. One of the things I like to say is I became, I became the man that I always thought I was before TMS, after TMS. So basically, I always thought I was, you know, high functioning, patient, energetic. I thought I was kind and funny. And then after I started getting the treatment, I realized that I wasn't always that person. I started slipping at some point. And that was very important for me. A high demanding career with a lot of self-pressure that I put on myself, as well as, you know, family life, being a husband, a father, a grandfather, juggling all those things. I was able to get my focus back. And I realized that I wasn't as busy as I thought I was, and I was able to put things in order, build nice habits and processes that I do, like meditation in the morning, and I kind of stack that with other habits. So I meditate, then I work out, then I self-reflect, and then I get my day started.
That's awesome.
And I always find time to look into my mirror and not spend as much time looking outside into the windows.
Oh my gosh, it seems like it's really helped you.
Absolutely.
And may I ask about how long? I know everyone's treatment would be a little bit different, but just from your experience?
Yeah, so I did 2 treatments. So my first treatment I started in, I think it was November last year. And then I came back for a booster treatment, I think in February is when I started.
That's it, and look how amazing you've done since then. This is so fantastic. Thank you so much, both of you, for joining us today. But if we want a little bit more information, number, website on the screen, okay to reach out?
Yes, Serenity Mental Health Centers, and the website is Serenity Mental Health Centers with an S.com. and we're ready and willing and able to take anyone and talk to you about our interventional psychiatry treatments. Thank you so much.
And I think it's so important. So thank you so much, and I'm glad you're doing well.
Thank you, Jordan.
Of course, yeah, you're changing people's lives. And if you'd like to see this interview again, everyone, just head to First Coast News Plus.